Are you going to hang tough on the public option? Clearly.
Fiery debate in Delmar. A crowd gets worked up at a town hall meeting on health insurance reform. Good evening and thanks for joining us. I'm Benita Zahn. Jim is off tonight. Well, tonight people on both sides spoke passionately about health care and insurance. Congressman Paul Tonko took their questions at a town hall meeting in a local park this evening. Kumi Tucker was there. She's live in the studio tonight with our top story. Kumi.
Good evening, Benita. We've seen these town hall meetings all around the country. Things get ugly. Things are contentious. This meeting, it was packed and it got ugly at times. But in between the heckling and the insults, there was some exchange of ideas.
You're the co-sponsor of the single-payer bill. Is the Senate and the Congress going to swallow the same pill you want us to swallow? Yes or no?
32.
Yes or no?
3,200 provides choice for everybody.
Choice for who?
For everybody.
The signs were out in full force, and so were the speakers. Some shared their experiences.
I worry if it means that we're going to have to rush into the hospital again. I worry because he isn't taking his medication properly because we can't afford it. I worry because neither one of us has gone for a regular checkup in almost a decade, and we don't really know how good or bad our health is.
For 2 hours in a hot and crowded pavilion, Congressman Paul Tonko took questions, moderated by former WNYT anchor Lydia Colbita. The deficit came up, and then debate over where it came from. Supporters say give people more affordable choices.
We can't afford the spiraling costs that we have. We can't afford to have 46 million Americans uninsured. So I think the time is now.
Sean O'Neill expects to continue with his private health insurance.
I would like to see that I have some guarantees within that I can't be excluded for certain reasons, such as a pre-existing condition, or I exceed a cap.
I think the president's proposal is going to bankrupt this country. It's not going to affect me. I'm too old. My grandkids' grandkids will not have the freedoms they have now. We already have public options. We have Medicaid, Medicare, we have VA, and they're all poorly run, and they're all losing money.
One speaker made reference to the Constitution.
Where are you getting the power, the authority to push this kind of plan?
But Tonko said this has come up before, and he was ready.
Rather than interpreting for you, I'll read right from the section of the Constitution. Article 1.
And both sides have certainly rallied over this issue, and we heard the debate continue even after the meeting had ended. Reporting live, Kumi Tucker, News Channel 13.